Ladies and gentlemen, the next brilliant doctor we have for you is Dr. Sim Hong Gee, urologist at Gleneagles Hospital. Now, Dr. Sim is a urologist who specializes in robotic surgery for complex cancers of the urinary tract, including prostate, kidney, bladder, testicular, penile, and adrenal cancers. Now, his extensive expertise in advanced procedures as well. He's also a council member of the Academy of Medicine Singapore. He's previously served as the president of the Singapore Urological Association, chairman of the chapter of Urologists, and director of the Urologic Oncology at Singapore General Hospital. Now, this man is amazing. Ladies and gentlemen, our final speaker for today, please, let's welcome Dr. Sim. Here we go.
Thank you. I hope you can see me. I'm Dr. Sim. I am a urologist, and urinary stones are my specialty. The discussion today will be on sharing some information regarding the kidney stone causes and how to prevent them. Now, you can see from the pictures, some of you may have friends or relatives who have had kidney stone symptoms. This may include severe colic, backache, nausea and vomiting, fever, and blood in the urine. A lot of patients have a lot of theories about how you can get kidney stones. They share amongst themselves on online portals, talking about diet, dehydration, metabolic syndromes, genes, or bacteria. So I'm here to clarify whether your next bowl of kway chap or chicken rice or drinks will help you or help you to get a stone or clear the kidney stones. So this chart serves to tell you that we live in a stone belt illustrated by the red color band. And in this area, which is mostly around or near the equatorial belt, there is a 10 to 15% incidence of kidney stone formation in the population. And because of climate change, in one example in the US, the kidney stone belt or the kidney stone risk belt is actually moving northwards. So why do stones occur? If you remember your secondary school science lessons, stones are crystals. So they form when there's an excess of crystal-forming substances that cannot be dissolved in urine. So this can be affected by changes and disturbances in the urine pH or acidity, urine volume, fluid intake, and various dietary factors. And you can see in the little pictures there on the left that there are different types of stones. These are some of the types. That includes calcium oxalate stones, calcium phosphate stones, struvite stones, uric acid stones, and cystine stones. By far, most of the stones we see, about 85 to 90% of the stones, are calcium oxalate stones. And when they first form, they are formed in the kidney. So they may be asymptomatic or no lack of symptoms, and they may not cause any obstruction. And they slowly move along down to the ureter, and that's when they can increase the pressure inside the ureter, causing severe spasm and pain. We have had patients who drove to the petrol station, develop a kidney stone colic, and leave the car there and go to the emergency room. And when they reach the bladder, then they can irritate your bladder and cause you to go to the bathroom very often. You may even have pain when you pee and even blood when you pee. So this is a black and white picture showing the different appearances of the stones under the microscope or under magnification. So broadly speaking, it's easy for us to group them into three categories. Non-infection stones, that's calcium oxalate stones, calcium phosphate stones, uric acid stones. Typically, uric acid stones are associated with increased weight. There's also a group of infection stones. These are the struvite stones. These are precipitated by urinary tract infections. Of course, there's also genetic stones. These tend to run in families. The most common are the cystine stones due to a defect in the transporter genes. So calcium oxalate stones are going to be the main focus of my discussion today because they are the most common and the one that you are likely to encounter or your friends and relatives are likely to encounter when they talk about kidney stones. So it can be associated with medical conditions, and of course for that you need a diagnosis by a an experienced urologist. This may include hyperparathyroidism, which is a hormone imbalance, renal tubular acidosis, which is a kidney condition, fat malabsorption, which is a gastrointestinal condition, and hypocitraturia, which is an abnormality of the urine concentration of citrate, which is a urologic condition. In most patients who have stones for the first time, and predominantly calcium oxalate stones, and no family history of metabolic abnormalities, we will usually treat the stones and not evaluate much further. But there are others who have repeated episodes of urinary stones, complex stones, uric acid stones or gout, calcium phosphate stones, type 2 diabetes, obesity, high-risk kidneys, such as those with one kidney or patients with transplant kidneys, or children with stones. They are the ones that we evaluate further. And this may include analysis of the stone when we do remove it, or fragments of the stones, and blood tests, urine tests for the stones, for the patients, and further imaging that may include X-rays, ultrasounds, CT scans, and so forth. But I think for most of you, the focus today is on food, what kind of food to eat, and maybe more importantly, what kind of food not to eat to minimize your risk of calcium oxalate kidney stones. This is going to be presented in a series of charts illustrating the background scientific data that back our recommendation today. In this paper by Loris Borghi and his group from Italy, essentially it shows that patients who drink more water, fluid, more than 2 liters per day compared to those with normal drinking habits, have a lower occurrence or recurrence of stone disease, and the interval to recurrent stone disease is also longer. So conclusion, drink more water. The other question that most of you will have is, does calcium restriction reduce calcium stones? So Gary Curhan from Harvard did several studies on stone diseases. This is one of them. He looked at questionnaires completed by 45,000 people over a 4-year follow-up, looking at stone events, that means formation of stones. And essentially, these numbers or this analysis suggest that when you have more dietary calcium in your diet, you actually have lower risk of symptomatic kidney stones. This is another paper by Loris Borghi, and in this case, he looked at 2 groups of people, one with low calcium diet and no restriction on salt and protein, and another group with normal calcium diet with restricted salt and protein, and look at the stone recurrence. So some of you may think that, well, if you take less calcium, maybe you have less stones. If you look at this chart, the dotted line is the group that has low calcium stones, and it suggests that in this group, they have higher stone recurrence rate, whereas the group with normal calcium diet, low protein and low salt diet actually have lower incidence. The relative risks are lower. Another study looked at the group of 91,000 women with no past history of stones, looking at the comparison between those who have normal dietary calcium and those who have supplemental calcium. In other words, calcium supplements from your favorite, I shall not name the company, but favorite brands. And does that help you to increase or decrease the risk of stones? So this study showed that high dietary calcium decreases or lowers your risk of symptomatic kidney stones, and supplemental calcium actually increases it. The role of sodium or salt in your diet is equally important. When you take more sodium, we found that it increases your urinary calcium excretion significantly, and therefore, this increases the production of calcium stones. So it is important to reduce your salt intake. in this case, sodium chloride intake. How can you further prevent or reduce your chance of getting oxalate stones? There are a lot of fruits and food products that contain oxalate. Oxalate is practically the Bitcoin of your food, so it's stored everywhere in the most important part of the plant. This may include nuts such as peanuts, cashew nut, almond nut, hazelnut, all your favorite coffee and tea because of caffeine, chocolates, okay? And oxalate-rich beverages that includes green tea, black tea, coffee, they do have potential benefits associated with decreased risk because of their diuretic property, but their caffeine content does increase the risk of stones, as shown in a study on healthy nurses in the period between 2007 and 2014. It appeared to show a dose response between caffeine intake and risk of stones. However, we do note that this study contains some recall bias and perhaps some unknown confounders. And there is at least one other study with some apparent conflicting data. But this is the main largest study that we have at the moment. You may also want to reduce certain vegetables. This may include brinjal, eggplant, lady's fingers, spinach, sweet potatoes. Certain fruits such as apricots, plums, figs, strawberries, all this contain high levels of oxalates. I know they're your favorite food. But just to remind you what it may cause you, this is an example of an X-ray with a large left-sided kidney stones. This is a Staghorn stone. This is what we are aiming to avoid. So there are other interesting facts about oxalate stones. Vitamin C and cranberry juice, excessive intake of those, may potentially increase your risk. And the link is because vitamin C, which is ascorbic acid, is broken down into the body into oxalic acid and carbon dioxide. And oxalic acid, the base of which is an oxalate compound. Cranberry juice also contains a fair amount of ascorbic acid, and therefore it follows the same trajectory. And from what I said earlier on, so it's important not to restrict dietary calcium in your food. That's natural calcium in the food. That includes dairy products, but not calcium supplements. That's not your natural dietary calcium. So, sorry, there's a bit of error in this line. So there are also other conditions that may increase the risk of production of excessive oxalate in your urine or hyperoxaluria. This may include previous bowel surgery, bariatric surgery, fat malabsorption that may increase the levels in your urine. Of course, there are others who may have some congenital conditions. We're not really going to focus on that. They are the exceptions, and they will need further evaluation that will lead to these diagnoses. What about uric acid stones? Generally, they are associated with ingestion of products that may increase the production of purines, which is a chemical compound that's essential to formation of uric acid in the urine. This may include animal proteins, red meat, eggs, organs, fish, shellfish, and your favorite beer. So, like what Dr. Lee has mentioned, generally eat or take your food in moderation and not in excess. Milk and cheese, low-fat cheese, they're generally fine. And if you have gout, you do have an increased propensity for uric acid stones because you have increased uric acid in your blood levels. And you may need to treat it, and some patients may need to alkalinize the urine with citrus fruits intake. Fruits, vegetables are generally fine. Animal protein, I've already elucidated that, and red meat and seafood produces the purines that increases the risks. Now, the DASH diet, or the dietary approach to stop hypertension, appears to be a middle ground where it allows us to recommend you a food that has high levels of fruits and vegetables and grains, medium or moderate levels of low-fat dairy, seafood, nuts, legumes, or beans, and low-salt red meat and processed food. That may decrease your risk of kidney stone formation. There's also a discussion about microbiome earlier on by another speaker. And in this topic, essentially, we're looking at bacteria that may help to degrade oxalate into its component products and be excreted in the gut before they're absorbed, resulting in lower levels of oxalate in the bloodstream and urine, and therefore lowering your chances of oxalate stones. However, in some cases where this bacteria or the levels of the bacteria may be affected by changes in your gut, such as conditions of a gut dysbiosis or inflammation, it may change your susceptibility to stone formation. And the typical bacteria that has been studied is Oxalobacter formigenes. And in this chart, you can see that when they have a lower level of Oxalobacter negative patients, they are more likely to form more episodes of recurrent stones. So in summary, we're looking at a few key increase your fluid intake enough for your urine to be clear, take less salt, less animal protein, maintain a healthy weight, maintain adequate dietary calcium intake. Do not take calcium supplements if you have not been advised to. Maintain a healthy intake of fruits, juices, vegetables, fiber, and reduce oxalate-rich food. These are charts showing some of your favorite fruits and food with oxalate-rich content, including beverages, vegetables, fruits, proteins, and grains. So I'm going to leave this chart here, and I would like to thank you for your attention.